Hi, everybody. Thank you so much for joining us today. My name is Michelle Morris, and I am with Consolidated Planning Group. We love presenting these free educational webinars in order to serve the special needs community. We are financial advisors in Texas, but we work all across the country. Today, some of what we talk about will apply to you no matter where you live, and some of it will be more um, centralized to Texas. So we're going to be talking about Government Benefits 101. I want to thank Cynthia Fogelman and give her a chance to tell us a little bit about her organization because she's sponsoring us today. So Cynthia, why don't you tell us about what you do?
Hi there. Hello, everybody. I'm Cynthia Fogelman. I am the Family Engagement Coordinator for Turtle Wing Foundation. We're located in Schulenburg, Texas. We serve three local counties around us. So that's Fayette County, Colorado County, and Lavaca County. And I'm going to read straight from our annual report a little bit about who we are and what we do and how we do it. Some history about Turtle Wing Foundation. It was founded in 2011 in memory of Jackson Allen Hooper. Jack, who was diagnosed with high functioning autism, died suddenly just prior to his 10th birthday. His passing sparked a fire within his family and community to help families who struggle with all learning differences. In the 2023-2024 fiscal year, Turtle Wing Foundation financially supported over 340 individuals with learning differences receive the services they needed. Over 1,200 families were enrolled in our parent support network. And let's see, hundreds more were touched by our early intervention, supplemental services, and education and advocacy efforts. Turtle Wing Foundation serves as a resource hub. We connect families who have children with learning challenges with the services and support that they need to be successful. We are dedicated to changing their lives. The foundation's goal is to help individuals fly academically, socially, and spiritually. How we do what we do, not only does Turtle Wing serve as a resource hub, connecting families with children who have learning challenges to the needed resources in the community, but we also help those families afford the services. Let's see. I'm sorry, I lost my place. As
That's
well
all
as
right.
look for partnerships like with Consolidated Planning Group to create new opportunities for families. By connecting with providers and partners, Turtle Wing has the ability to underwrite programs as well as fund individual scholarships for services ranging from speech therapy to inclusive dance classes. Our providers are the boots on the ground, performing amazing services, and Turtle Wing provides the funds to increase program reach and make sure that no family goes unassisted due to their economic status. So that's a little bit of who we are and what we do. So thank you so much for partnering with us today and not just helping our Turtle Wing families here in this area, but obviously lots of people across the state.
I love that so much. Thank you for being here with us today and sharing that information. I would love it if you could put your information in the chat box so that if somebody wants to reach out to you with more questions about working with your foundation, that we know how to get in touch with you.
Will do. Thank you.
So, a few little housekeeping items. As you can see already, I've mentioned the chat box several times. I focus on that when I'm presenting. It's the easiest way for me to be able to see and answer questions as I'm presenting. So please put any questions or comments that you have in the chat box. We should be here for about an hour today. Our webinars usually run until about 1 o'clock. This one has a ton of helpful information. But don't worry, you don't need to take copious amounts of notes because we do record every single webinar. And after we present them, we put them on our YouTube channel. We send you the link to that recording and we send you the slides. So you'll have everything you need. All of the links will be clickable for you later on today. And of course, you'll have my contact information so that you can reach out to me directly if you should have any further questions that we don't get today, or maybe you're not comfortable reaching out in public with your questions, whatever the situation might be. So first things first, why should you even be here listening to Consolidated Planning Group? Who the heck are we and what do we know? Well, we are one of the very, very few financial planning firms in the United States who focuses on serving families where there is an individual with some kind of intellectual or developmental disability. We work all across the United States. We're located just outside of Houston, but we can help families everywhere. We've been doing this for over 30 years. We're members of the Special Needs Planning Academy. We are national certified Social Security experts. And I am a chartered special needs consultant through the American College of Financial Services. So, like I said, we really take this seriously. We 90 something percent of all of our clients have children with disabilities. It's not just something we do once in a while. This is what we do. We're fully licensed in life insurance and investments, securities, all of those aspects of money management that you would expect from any financial advisor. We just take it further with our special needs planning options. So we help families with things like protection plans, lifetime care planning, transition planning. There's big transitions that come along in our loved ones' lives that we need to be ready for. ABLE accounts and how to use the ABLE account, maybe in addition or in partnership with your special needs trust. And of course, we're here to advocate for you and to educate you. There is so much information out there and so many well-meaning people who, might try to help, but might not necessarily know all of the right answers. So we encourage you to come to us to learn. We can help implement things that you might need, but it's really important to have a trusted source of the correct information. So across the United States, there are over 263,000 financial advisors. But out of those 263,000, there are fewer than 200 firms that focus on special needs planning. So you are truly in the right area when you come to us at Consolidated Planning Group. And I personally don't know of I don't know of any other financial planning group that focuses on special needs planning that produces webinars like we do to be able to help the community. We also give a completely free initial consultation. If anybody has questions after this is over, we can set up a quick meeting where you can discuss with me or one of the other financial advisors on our staff. And we'll answer any questions that you might have about special needs planning. And then we go on to talk to you about how our company works, what we charge, and if you think it would be a good idea for us to move forward together. So keep an eye out that. What is the reason that we decided? Thank you so much. I love that question, Elena. We decided to focus on special needs planning because the owner of our company has two children with disabilities. And when Allison was going through this with her own family, she was already a financial advisor, but she was very shocked by how confusing and cumbersome and the nuances of things that you need to know to be able to plan for all of these additional issues and the rules and regulations and making sure you don't jeopardize your benefits. So as she was going through this situation with her own family, she says, my goodness, I am in this field. I should know this stuff and I don't even know it. So how are my clients supposed to already know this stuff? And that's when she decided that her whole company should really focus on helping families like hers make sure that they understand all of these different things and know what to do. And I came from a teaching background, so I was a teacher working with special needs kids. So all four of us financial advisors on the team have some connection, but really, it's just in our hearts to serve you. So one of the first things I wanted to get into today, and I did get a list of questions that people asked when they registered, so I'm going to try to hit as many of those as possible. But first, I want to go over the difference between two common acronyms, things we hear about all the time, SSDI and SSI. These are two different programs from the Social Security Administration. SSDI is Social Security Disability Insurance. Excuse me. SSDI can also be called Disabled Childhood Benefits or Childhood Disability Benefits. Some people call it RSDI. That's all the same thing. That's all on the left-hand side of the screen. SSDI comes from the Disability Trust Fund, and it is insurance that you pay into Social Security, and because you've paid into Social Security through your work, you are able to pull out your Social Security benefits later in life when you retire and you turn them on. In order to get SSDI, thank you for the question, Veronica, you do have to have work experience because remember, we're talking about the parent working typically for our families when we're talking about SSDI. So SSDI can pay benefits for disabled individuals who are unable to work, even if they haven't been able to work, because it would be based on the parents' income and resources and Social Security benefits. So what we typically see is that the benefits are for the worker and for the disabled children of the workers, but they have to have enough work history. The parent has to have enough work history for the disabled adult child who does not have enough work history to pull off of the parent's record. We're going to get more into it, I promise. It's not as confusing as it sounds. Just remember, SSDI is Social Security Disability Insurance, and that would come later in your child's life. SSI is Supplemental Security Income. And this comes from general tax revenues, not the Social Security Administration Trust Fund. This is from a different source of funding. And this is a needs-based public assistance program. You do not have to have any working history. You do not have to have a parent who has any work history. You can get this if you are unable to work and you have very limited income and resources. So we all know that those limits are very, very low. We're going to go over those. But this benefit is meant for children and adults who are in financial need. You cannot have more than a very small income. This year, your substantial gainful amount is $1,620 a month. We're going to go over that again. And the asset limit is still $2,000. Okay, so let's look at what does this look like in real life, in the ideal timeline of things. So when your child gets diagnosed as having a disability, the very first thing that you want to do is get on the waiver waiting list. Now, in some states, they have a short list, maybe a couple years. In some states, there is no waiting time at all. You're able to just sign up and get resources. In Texas, these waiting lists can be as long as 20 years. So at diagnosis, the first thing you want to do is contact your local Intellectual and Developmental Disability Authority, your LIDA, LIDDA, Local Intellectual and Developmental Disability Authority, to get on the waiting list for those waiver programs. There's also a website where you can go sign up for those for Texas. It's yourtexasbenefits.com. But get on the waiting list, okay? Most people will not qualify for SSI until their child turns 18. And the reason is that when your child is a minor, they're going to look at the parent's income and assets to see if your child qualifies for SSI. But the asset and income limits are so low that most parents make more than those limits, and your child won't qualify. But as soon as your child turns 18, all of a sudden, Social Security is not going to look at the parents anymore. They're only going to look at the children's assets and income. So as long as your child is not making too much money, doesn't have too much money in the bank, then they would be able to qualify for SSI benefits. And that benefit comes with Medicaid automatically. So when you get SSI, you automatically get Medicaid with it. So you'll be going along for several years, getting your SSI monthly payments, having Medicaid, living life, okay? Hopefully your child will be on that for several years. And then later on in life, you're going to be in your late 60s, and it's going to be time for you to turn on your Social Security retirement benefits. So you as the parent in your late 60s, you're going to go ahead and turn on your Social Security retirement benefits. And when you do, whatever amount your check is for, your child will be able to draw a check for half of that amount. So let's say, for easy numbers here, let's say my amount is $4,000 a month from my personal Social Security retirement. I turn that on, I start getting my $4,000 a month. My disabled child would start getting $2,000 every month, which is more than double what SSI is right now. So we definitely want my child to switch. They're going to turn off SSI and turn on SSDI. My child will now be getting $2,000 a month instead of $967. And after my child is receiving SSDI for 24 months, that's 2 years, then they will automatically be able to qualify for Medicare. And at that point, you don't lose your Medicaid. So you get to keep Medicaid and have Medicare and be making, half of the amount the parent gets. In my case, remember I would get 4,000, my child would get 2,000. Now, when I pass away, my child's amount is going to go up to 75% of what I was getting. So my child's amount when I pass away will be $3,000. Okay, that's the ideal way for this to work. And one very, very, very important thing here is that you really want your child to qualify for SSI and Medicaid before you get your child qualified for SSDI and then Medicare. And here's the reason. Sometimes, we have widows. We have widows where the spouse passed away before the child turns 18, and the child is entitled to some SSDI money at that point. But you have to be very careful, because if you skip the step where you get SSI and Medicaid, you could accidentally lock your child out of Medicaid for the rest of their lives. So please, before you turn on your Social Security retirement benefits, make sure that your child already has their SSI and Medicaid in place. Or give us a call and we'll walk you through it. Okay. If you have Okay, perfect. Thank you so much for the questions and comments in the chat. What if the parent, okay, what if the parent has spent the majority of the child's life not working? They're a stay-at-home parent. Well, unfortunately, your Social Security benefits, your retirement, and your child's SSDI are not going to be very much, but you'll still be able to get at least the amount of whatever SSI is. Sometimes that happens where the parent's amount is less than SSI, so the child will get both SSDI and SSI at the same time to true up that number. I hope that makes sense. The next question I see is, if you have married parents, or, you didn't ask this, but the same holds true for step parents Who does the benefit amount get determined from? So when you switch to the SSDI, your child can go under the record of whichever parent turns on their benefit first. Your child will go under that because that's getting started. And then after the first parent turns it on, they can switch to whichever parent has the highest amount. So let's say mom and dad have divorced and both got remarried. So you have mom and stepdad and dad and stepmom. Your child can choose from any of those four Social Security benefits, as long as the parent is cool with it, and go under whichever one has the highest benefit. And they can even go under adopted parents. Um, if grandma and grandpa have adopted the child, then they can go under the grandparents. Okay, and if a parent has several children with disabilities, there are family maximums. So if you have a spouse and two children or three children, you have more than one person drawing from that benefit, there are some family maximums. So you do want to watch out for those. Okay, let's move on a little bit. So in order to get SSDI or SSI, you do have to have some kind of physical or mental impairment. You do have to be deemed as having an impairment under the eyes of Social Security. This has to be a disability that is going to last more than 12 months or eventually result in your death, or the death of the individual. They do look at your age, education, past work activity, and whether or not you are able to perform substantial work activity. So that substantial gainful activity for 2025 is $1,620 per month. That means that your child is allowed to make $1,620 per month and still keep at least $1 of SSI benefit. If they're blind, they can make more, $2,700 a month. Now, if your child makes over $1,620 a month, they will not receive their SSI benefit because that's the limit. If they make more than $1,620 a month for 9 months or more, they will never be able to receive certain benefits. They would be earning their own SSDI at that time, so they would be unable to get it under a parent's record, and they would not be able to get SSI. So they wouldn't be able to get SSI turned back on. So if they started working and they're earning more than the substantial gainful activity for 9 months or more, then they're just going to have to go off of their own SSDI in the future. Okay. The benefit effective, oh, I'm so sorry. We updated the number, but not the date. So for 2025, SSI is $967 a month. So $967 a month, $1,450 if both parties are disabled. You would think that they would just double the individual amount, but no, there's a penalty if you're married to somebody who is disabled and you are disabled. I don't know why. I don't know why they do that, but that's the way it is. Okay. I answered that. We'll get to how you schedule a consultation, Veronica. Okay. Very, very good. I love seeing the chat box. So the Blue Book. The Social Security keeps what they call a Blue Book. And this is the guide that they use to determine whether or not a person is qualified as having a disability. So you're going to look in the Blue Book and you want to look up any of your child's diagnoses. Maybe they have autism, an ADHD, and a general anxiety disorder. So you look up those three things and you're going to see listed out in the Blue Book exactly what it takes to prove that your child has a disability. So if you look up autism, it might say, your child has these criteria, your child cannot work because of their disability. Your child has prolonged, just inability to concentrate, inability to complete tasks, blah, blah, blah. It lists it all out. Then you want to look at your child's records at their doctor's office and make sure that the things it says in the blue book are listed out in their doctor's records so that they know that it's true that your child has these difficulties and can't do these things. There's also a link here for the entire Social Security SSI website for you to look up more information about that. So if you have questions, you can refer to these guides. And like I said, when you get the slides, these links will be clickable. I see a question here in the chat box that I would like to address. Well, I see a question that I can't address. Why did Texas never create a Medicaid category for children with that IDD so we don't have to keep reapplying? I'm sorry. Texas just didn't, I don't know. But this question, if they get $2,000 a month for SSI or SSDI payments, I assume Oscar is asking about SSDI payments. Doesn't that disqualify them from Medicaid? No, because there's a thing called the Pickle Amendment. The Pickle Amendment says that if a person is on Medicaid and SSI and they get SSDI and Medicare, they don't have to follow those limits because they're pushing you over that limit. And they know that, and they know you're a disabled person who couldn't work on your own and has to rely on benefits. So they baked that into the equation. All right, I have someone. Okay, so the maximum amount of money that a person is able to earn if they're on SSI is $967. So the question I'm seeing in the chat box is, I have someone whose SSI keeps getting knocked down to under 967. All combined, they're getting SSI, work, SSDI. Why isn't it 1620? 1620 is the amount of money you're allowed to earn if you have a job. $967 is the maximum amount of Social Security, SSI, that a person can get. If your SSDI is not at least $967, they're going to make you whole to that $967, but they're not going to give you more because there's not a Social Security earnings pay in to back that payment. I hope that makes sense. Okay, so when your child turns 18, you need to apply for their SSI benefits. Again, that comes with Medicaid. Sometimes when you fill in the application for SSI, they also populate an application for SSDI. So if you get a letter in the mail that says you've been denied, make sure you look at the top right-hand corner of that first page of that letter and make sure you know, are they talking about SSI or SSDI? They're very different. You should not probably qualify for SSDI yet. That comes later. Don't forget. It does take time. You cannot start this process until they turn 18 or else they will be disqualified because of your income and assets. So you're going to go to this website. You're going to create an account for your child and apply for their benefits. And you can do this for them even if you don't have guardianship or anything like that. It is totally fine. They're going to save the date that you started the application. And then even if it takes a year for you to get benefits, they're going to backdate that pay. And they will send you the payments that they've missed because they were being so slow. When you're getting ready to apply, you want to gather up your physician's names, any doctors that are currently seeing your child, or the last doctors to have seen your child. You want the doctor's contact info, names, address, phone numbers. You want a list of your child's diagnosis history. You want a list of their medications. If your child is working, they are going to want to see pay stubs to make sure that your child isn't working too much. And then they're also going to want to see bank statements, three months worth of bank statements, to make sure that your child doesn't have more than that $2,000 in their bank account. Okay. Now, the thing about this back payment, because again, people say, oh, well, I know I'm not supposed to have more than $2,000 in my child's bank account, but the Social Security Administration just sent me $12,000 in back pay. What do I do? It's okay. They know that they caused that. So you have 9 months to spend that money or move it into an ABLE account or a trust, or, do something with that money. And we can help you figure that out. So again, a decision can take more than 6 months, sometimes even longer. When your local office finishes your application file, they send the entire application to Disability Determination Services, which is in Austin. And those are the people who are actually going to look through all your answers, look at the doctor's records, and make sure that everything matches up and that your child is qualified as having a disability. Now, you can call DDS. Every state has their own Disability Determination Services office that you can look up, and you can contact them and ask, who has this been assigned to? Did you get all the records that you need? Is there anything I can do to help? And they will talk to you. So that's good that we finally have an office that will help. Now, I did say that it takes usually up to 6 months to get an answer, and usually longer. But they do have a list that they call presumptive disabilities. And if your child has one of these disabilities, then they kind of know. They don't need that much documentation. They know your child is going to be approved in all likelihood for resources. So they move the process along a little bit faster. And sometimes they call them compassionate allowances. Sometimes they call it a presumptive disability. But things like, if you're missing a leg, you've got an amputation at the hip. If you've got Down syndrome, totally deaf or totally blind. If you have an intellectual disability, that usually means an IQ below 70, and you have a complete inability to take care of yourself, like toileting, eating, bathing, dressing. If you've had a stroke, if you're confined to a bed or a walker or crutches, muscular dystrophy, things like that are presumptive disabilities, and they should be able to get you an answer faster. Now, your child can earn SSI and still have a job. It's just that they can't make more than that 1620 number that we talked about. So what happens? What does it look like if your child is working and getting SSI? So this little math equation shows you what would happen. Let's say your child earns $1,200 a month. First of all, they take general exclusions off the top of $85. So take off that $85, and that brings us down to $1,115 in our scenario here. You're going to divide that number in half. That gives us $557.50. And then you subtract that number from the total amount that they could get, the 967. And that means that your child should be getting $409.50 in SSI benefits. So you can see that by working, it's not a dollar for dollar reduction in SSI benefits. It's about 50 cents plus that $85 thing. There is also a student earned income exclusion. So if your child is a student regularly attending school and they're working, then they can earn more money without their SSI being affected. You do have to ask for this. They're never going to call you up and say, hey, we see that your kid is working and in school. Let us help you out. They're not going to be like that. So you have to ask for it, okay? I'm going to see what questions are in the chat box while you guys look over the rules for the earned income exclusion. To qualify for SSI at age 18, does my child have to have a medical diagnosis from a doctor? Yeah, Yeah, pretty much they do. I know a lot of schools are diagnosing things, and if the school did the IQ test and the IQ test shows, that there is an intellectual disability, you definitely want them to see that. But I don't think that school testing is really going to be enough. You do want your child to get in to see a primary care physician for a diagnosis, typically. Um, if you want to look up uh, what other limits are, the website for the Social Security Administration that I shared with you is going to be the place to go to look up this Understanding SSI link. Who is that? CR is asking where you can see how other benefits would work. This would answer all of your questions, CR. Is the lawsuit for the 504s? Ooh, Caroline. Caroline is bringing up questions that I don't have the answers to. Um, okay, and Veronica, thank you. Okay, so quick note about the current administration and what's going on with the Department of Education and getting rid of 504 plans. And even the thought that they're talking about getting rid of Medicaid and Medicare and Social Security. We don't know what the future holds. What we can do is go by what we know is happening right now. And I did receive some questions about that before the webinar, even, how are we going to navigate what they're doing? We don't really know. What we can do is stay up to date, keep you informed, and keep our planning skills, what's the word I'm looking for? Flexible and able to help you no matter what happens. We're going to plan for what we know right now. And as things evolve, we can evolve the planning we've done for you. Okay. Thank you so much, Kara. She says IQ testing for 18-year-old applicant must be after age 16. So they want it to be within the past 2 years, it looks like. Okay, let's talk about child support. Did you guys know that the divorce rate for parents with a disabled child is more like 80%? So if child support is a thing in your life, because you can get child support beyond age 18 if you have a special needs child. What you're going to need to do is have that child support after age 18 redirected into a first party special needs trust. A first party trust is for money that belongs to your child, and child support after age 18 is considered your child's money, and it is considered as income. So the way to prevent it from affecting your SSI benefits, well, your child's SSI benefits, is to make sure that it goes into a first party special needs trust. Okay, we've pretty much talked about how to get your SSDI benefits and the fact that when the parent turns on their benefits, the child can get half of that benefit. After 24 months, you get Medicare, and when the parent passes away, you get 75% of their benefit. And we've already mentioned that there are family maximums. So like the question I saw in the chat box, if there's multiple people drawing off of one parent's work records, you could run into family maximums. And we can go through that with you if you're interested in understanding exactly how that works. So how do you prevent your child from losing any of these great benefits that they finally get from the government? First of all, you want to make sure that you have your child's money in the right buckets. Your kid can't have more than $2,000 in their bank account, but they can have an ABLE account and they can have a special needs trust. And those are not counted against them as assets or income. So make sure that when you want to leave money to your child at the end of your life, for example, your life insurance, investment accounts, bank accounts, whatever, you do not leave it directly to that child. You're going to leave it to their third-party special needs trust, because that's not their money yet. You're going to leave it to the third-party trust, and that is the ideal way to do things. So you also want to let any well-meaning family members know, if grandma and grandpa want to leave an inheritance for your child, great, but don't leave it straight to little Johnny. Leave it to the special needs trust for the benefit of Johnny, and everything will be much, much smoother, and it won't cause Johnny to lose his benefits. So one place that you can have money is the ABLE account. You might have heard of a 529C. That's the 529 college savings account. Your child can have one of those, but that money can only be used for educational expenses. So if it's possible that your child will not need money to pay for college or educational expenses, you can instead put that money into an ABLE account. It works very, very similarly to a 529 college plan, but this is a 529A for ABLE. It doesn't affect their Medicaid or SSI. They can use the money in the ABLE to pay for anything that your child needs, anything that will help them achieve a better life experience. That's what it stands for. There are limits to how much you can put in, but once you put your money in, it goes to purchase mutual funds. And as those mutual funds earn interest, that interest is not taxable. So you do have two big benefits there. The fact that it doesn't count against their SSI or Medicaid, and the fact that it has untaxed interest growth. So you can put $19,000 in for 2025, but you never want your ABLE account to go above $100,000. And an ABLE account is for any disabled individual where that disability began before age 26. At the end of this year, they're going to change that age limit. So if your child is 27 and you want an ABLE account, wait until next year. Again, you can use the distributions for anything your child needs. There's no penalties, there's no income taxes or anything like that. And you can roll it over if you have another family member who is also has a disability before age 26, you can roll it over to them. You can leave it to anybody, but Medicaid does get first dibs after your child passes away. If they've had Medicaid pay for anything for them, this is where Medicaid can come back and claim reimbursement. So at the end of your child's life, maybe you want to spend down the money in the ABLE account, or maybe once your child switches over to SSDI and the Special Needs Trust, you close out the ABLE account. But again, Medicaid can come back and claim reimbursement. So your ABLE account, I don't see any questions popping up in the chat box, so I'm just going to keep rolling. If you're tracking with me, great. If not, please put your questions in the chat. So for the ABLE account, you can pay for almost anything that your child needs. There will be no reduction in your SSI or Medicaid, even if you use the ABLE account for food and shelter, transportation, education, really anything, even a vacation. Anything for your child you can use the ABLE account for. Now, that's the main difference between the ABLE and the Special Needs Trust. They work together. Thank you, Veronica. They work together. So in your ABLE account, there's that limit of $19,000 per year that you can put in, not to ever let it go above $100,000, but you can use it for anything that you need. With the Special Needs Trust, you can put as much money in there as you want, millions. We hope you're going to have millions in your Special Needs Trust. But if your child is still on SSI benefits, if your child is still on SSI benefits, you do not want to use the Special Needs Trust to pay for housing, rent, utilities, real estate taxes, any homeowners insurance that the lender requires, all of this list of residential things, plus you don't want to get any cash out of that account or use it to pay for food, okay? But you can put as much money in there as you want. So that's why it's very, very advantageous for you to have both the ABLE account and the Special Needs Trust. Know what you can pay for with which account, and you can move money in between those accounts. We typically see it going from the Special Needs Trust into the ABLE account to be able to pay for more things. Again, we can walk you through that again if you ever have more questions. So this is the Oh, okay, let me go back because Rochelle wants to know what can the special needs trust be used for? So, okay, don't use it for housing, food, cash, food, shelter, housing. Don't use it for that. I mean, food, cash, house, you know what I mean. Everything else is okay. Um, Transportation, education. What if they need to buy a car? That's fine. If they need to pay for medical bills, if they need clothing, if they need a vacation, a car, a computer, educational courses, basically anything, Rochelle, just not housing or most things to do with housing. Okay. I hope that that's clear. Okay, good. So no matter what age your child is, getting started right now is the way to go. I don't care if your child is several months old or a toddler or middle school, high school, or an adult, anywhere in between. Right now is when you need to get started planning. And the reason you need to plan now is because it's much easier to make smaller changes if you have a long period of time. If you don't have a long period of time to plan, you have a shorter time period, we're going to have to make more drastic changes and we're going to have to make them quicker. That's fine because we know what to do and we know what needs to be done. If you have a long time horizon, that gives you a little bit more flexibility and makes things a little bit easier. Think about what's going to happen after high school. There are great residential options, transition programs, day programs, summer camps, all kinds of wonderful things. There are vocational options like the Texas Workforce Commission or Project Search that will help your child with job training and job possibilities. Um, there are educational programs at colleges all across the United States where they have specialized classes for our kiddos and specialized support systems for them to be able to be successful on a college campus and in the dorms. We also want you to think about who is going to take care of your child when you can't do it anymore. And we don't want you to just automatically assume that, okay, little Johnny's sister, Sarah, she's neurotypical, so she'll have a job and she'll be able to take care of him once we pass away. Well, yeah, that sounds ideal and it sounds like it would be a less expensive option. But from our point of view, we have met with lots of adult siblings who are the caregivers and the caregivees, and most of them do not like that situation because what we're finding is the adult children who are becoming caregivers, they've got their own jobs and families and lives, and they might be unable or unwilling to provide that care. And if mom and dad haven't put their own planning into place and they just leave everything to that sister, it feels very overwhelming and kind of unfair for that sister. Mom, dad, why did you do this to me? I love little Johnny and I want to be there for him, but let sister be there as a friend and a mentor. And then on the other hand, little Johnny, he's had this partner in crime his whole life, this great sister. They're great friends, but all of a sudden, sister is trying to step into the role of caregiver. And that feels a little bit like she's trying to be in charge and being a parent. And I don't like that. Sister is my friend, not my mom. So it can create resentment on both sides of that equation. So just be really careful about that, okay? I see we have about 10 minutes left, so get those questions in the chat box for the last 10 minutes. I'm going to wrap up these last couple slides and then we're going to dig into the chat. Okay, so these are some of the things that we talk about in our webinars and some things to keep on your radar related to special needs planning. Future care cost estimates. We look at while you're here as a parent on earth, it's kind of part of your budget to take care of your children, even if they are adults who happen to be disabled. But when you pass away, there needs to be a stockpile of money set aside for someone else to take care of your children. What does that look like? How much should that be? That's the future cost of care that we help families figure out. The waiver programs and interest lists, make sure you are on the wait lists. And if you ever meet anybody who has a child with a disability, that is the biggest piece of advice. Get these kids on the waiting list. SSI and SSDI, as we've discussed today, these are very different programs with different intents and different time and different planning needs. So knowing when to apply is very important. The ABLE account, we can sign you up for an ABLE account. You can sign yourself up. It's not very difficult, but there are ABLE accounts all across the United States, and you do not have to pick the one for the state that you live in. You can mostly pick any of the ABLE accounts. Some of them do say you have to live in their state, but generally you don't have to live in the state where the ABLE account is. Beneficiary designations, we talked about don't leave the money to your child, leave it to their trust. We talked about child support beyond age 18. We talked about residential living communities. I know that we have some great panel discussions coming up for summer camps and things like that. You might want to watch out for that. We often have attorneys on to help talk about guardianship and of course, other post-high school educational options. Now, when you receive these slides, this link will take you straight to our website events tab, where we have all of our webinars listed. You can register ahead of time for the webinars. And then even if you can't make it, you're going to get a reminder, and then you'll get the slides and the link if you register, and then you can go back and watch it later. So you don't have to be present for our lunchtime webinars, but I do love having lunch with you. This is our entire team. Again, there's 4 financial advisors. It's 2 sets of husband and wife. So Allison and Jeff are married, and they have 2 children with disabilities. They have 4 children altogether. And Allison she got into financial advising right out of high school, as you can tell by her perfect skin. And then there's myself and my husband, Andy. We've got 2 boys. They're 23 and 21. Neurotypical, but they keep us very, very busy. And then we've got a great staff of people behind the scenes helping to make sure everything gets done. We are members of Special Needs Planning Academy. We are National Social Security Advisors and chartered special needs consultants. So we truly know how to help you. And as you look at all of these smiling faces, I hope you will understand that we are here to help and we don't bite. And when we call you to see if you would like to schedule your free consultation, please be polite. We've had people hang up on us, and that's just not necessary. We are calling you to see if you have any further questions. If you have any questions about benefits or any of the things I've talked about today, we offer you a free chance to come talk to me or Andy or Allison and have these things explained to you. You can tell us your own situation and we can give you advice. And then we're going to get to know your family a little bit, and we're going to tell you about how we work and what we do and what we charge, and decide if you want to move forward with us. Now, I can schedule your consultation. I'm putting my info in the chat box again because I do get credit for scheduling appointments. If anybody wants to call me or email me directly, I will schedule your appointment for you. Or you can use the QR code or call the office. This page also has all the links for the YouTube, Instagram, our podcast, and our Facebook page. Okay, and then finally, there's one last page of disclosures that you can read through when you get that later. So I will leave this screen up while I answer your questions and make sure that we've got everything taken care of here. So some clients get SSI and Medicaid. Then they turn 18 and lose Medicaid, but still get SSI. So yes, they're different programs. And if your child is on Medicaid or SSI or SSDI, if your child is getting any benefits before age 18, there is a possibility that at age 18, your child might need to reapply. They should flow smoothly from one age to the next, but This is the government we're talking about, and they're not always known for efficiency, are they? So when your child turns 18, you might need to reapply for some of your benefits or all of your benefits, or apply for different benefits. Okay, you would contact Medicaid to apply for that. Can someone with IDD apply for and get Medicaid when they turn 18 while they're still waiting on that SSI? Um, you can try to apply for Medicaid separate from SSI. You would have to, still meet the low income and asset requirements. But it does come through as soon as you get, but there is that wait, right? I understand. If your child is covered by your job's health insurance, I mean, that's the ideal situation. But you might need to kind of put doctor's visits on hold for a minute if possible. We can help talk to you and walk you through what to do there, Teresa. Elena wants to know about respite programs. So once you get a waiver, that's where the respite care comes from, is when you get a waiver. HCS, class, Texas Home Living. When you get a waiver, then you generally get respite care, nursing hours, transportation, lots of different benefits. What is the reason that a special needs trust cannot be used for housing? Well, they want you to use your special needs, your SSI money. Okay, let me get this straight in my head before I spout out an answer. Oscar, they want you to use SSI money to pay for housing. If you don't need SSI money to pay for housing, they don't give you as much SSI money. As a matter of fact, when you first start getting it, if you don't tell them that your child is paying you rent, you're not going to get the full $967. Once you tell them, oh yeah, my child pays $500 a month for room and board, and we take it out of their account every month and put it into our account and use it for room and board, then your child might get the full $967. But like I said, they feel that if your child doesn't need SSI to help pay for room and board, then you don't get as much money. So that's why you should use money from SSI to pay for room and board. If you use money from the special needs trust, they say, oh, you don't need so much money from us, you've got it. So that's why. Is a special needs trust better than a savings account or an investment account? Veronica, both a savings account and an investment account will be held against your child when they're looking at assets that your child has. So once they get to $2,000, they're going to lose out on benefits unless it is in a special needs trust or an ABLE account, because those won't count against the child. And that's where you can put millions of dollars aside for your child for their future care once you're gone. That's why it's so important. I don't know why we have to jump through these hoops, but that's the way it's set up. Okay, how is spousal income counted as income for the spouse on SSI? Okay, CR. So you have, you know what, that question's pretty complicated. I would think that if you could set up a consultation with us personally, we can dig a little bit more into that and find some answers for you about spousal, SSI, and deemed income and all of that. Does Consolidated Planning Group provide support and services to people who are dealing with dementia? We can help with all kinds of services. It just depends what's out there through, national supports and things like that. We help connect people to services and resources that are there for them. We help you plan for your future and for your loved one's future. Guardian of a sister with ID. She lives in an ICF, a care facility. If a medical situation occurs and she requires a higher level of care, can the special needs trust be used to pay for that higher level of care? Yes. If you're paying for her care, yes. And especially if she's not on SSI anymore. Rose, again, another perfect candidate for a more in-depth consultation to make sure we get get your questions answered. Elena, I see you want respite care so bad. We can help you, I promise. All right, we are running out of time. I do see that there's a couple more questions left. I'll try to get to some of these if you guys want to hang out with me. If not, I understand if you drop out. But do go ahead and schedule your consultation. When there are multiple disabled children, the parents' income is split between the children. How about also having a spouse on SSI? Like I said, CR, that one I'm going to have to dig into. So please set up a consultation so I can figure that one out. Okay. Sometimes your LIDA has a list of respite providers. Elena, call your LIDA and ask them. If you're on the waiver program and then you turn 18, do you lose Medicaid? You might have to go back and get Medicaid as an adult. Different sides of the same coin, different versions of the same program, but you might have to reapply. Okay. If you move money to an ABLE account or a special fund account, is there a time limit that Medicaid takes in effect before you qualify for Medicaid? There shouldn't be a time limit, but it does still take time to get that application filed because they're so slow. Does that make sense? Okay, last question. Yes, we're going to send all of these slides and the recording to whatever webinar, whatever email address you used to register for this. Hopefully you used the correct, a real email address, because that's where all of this information is going to go. Does money in the ABLE account affect SSI payments? No, it does not. And then this one last thing I saw, does a special needs trust fund affect Medicaid? No, it does not. Last question. I hope you all have a fantastic week. Please reach out to me personally or call the office. I would love to be able to chat with you more and explain all of the nuances in your personal situation. Thank you all for joining us again today, and Cynthia for sharing the information about your foundation. Please reach out if there's anything I can do. And other than that, I think the last thing I'll say is if you enjoy these webinars, if Consolidated Planning Group has been able to help you in the past, please send us a quick note and let us know. We would love to add your kindness to our website. We have a testimonials page. So we would love to put some of your kind words on there if you have any that you would like to share. Thanks a lot, everybody.